also, another example that I was thinking about in Richmond is that St. Francis does just a wonderful job of caring for the underserved community. A lot of their obstetric patients are undocumented immigrants who are on Medicaid for a short period of time during their pregnancy. And something I saw while rotating there, both as an acting intern and then also during an OB rotation there, is that a lot of these women are really struggling to make ends meet, and they're struggling to feed their babies if their breast milk supply isn't coming in. And so they're struggling to afford formula, and then they're also struggling to get food for their entire family because babies are such an expensive cost, and their finances get really tight just being able to afford their child. And so programs like this could, in theory, help people a lot who are struggling financially just to have food for the whole family. And that's just not only going to help the mother and father and the whole family, but also the baby as well. Like, just to have a healthy family around them that can truly take care of them and devote enough time to them as they're growing.
I mean, going off that point too, you're talking about formula versus breastfeeding, etc. And, breastfeeding requires a lot of nutrition.
Yeah.
And if somebody's food insecure and they're having issues with breastfeeding, etc., making sure that they have food production, could be a contributing factor that could really help them.
Yeah.
I think it's really important for us to see, kind of talk about these things. And I think it's good that we've seen, inside of all of these different facets of the hospital system, whether you're outpatient, whether you're inpatient for surgery, whether you're on OB and pediatrics, etc. Food insecurity plays a role kind of throughout the health system. So having, one intervention that can help across so many different disciplines, specialties, etc. It seems like a no-brainer, right? So working out these kinks, I think we talked about the pitfalls, etc. But going back to that working out these kinks has a purpose. It has a tangible impact on the people that we're caring for. And if policymakers could figure that out, figure out the streamlining thing, if the finance bros and tech bros could get on it and figure out how to streamline this process for the sellers, you can see this tangible impact that'll definitely impact the healthcare system, and then we'll probably have other effects throughout the community. We're not close to experts on that, but I think that could really make a huge difference. So all in all, huge incentive to get this done.